using just a platform to be able to answer questions regarding the heart, regarding anything in the world of cardiology and also outside of the world of cardiology. So, um, once again, my name is Dr. Isang, and I'm a non-invasive cardiologist. So this means that I see the bread and butter of medicine. I see things like heart failure, hypertension, especially hypertension that is difficult to control or hypertension that is due to something else. So if you have any questions, let me know what they are in the comments. Let me know where you're tuning in from, and I'll be able to answer it. So uh, if there's one thing that I can talk about, or a few things, and the first is going to be understanding what the risk factors for heart disease are, so understanding that things like high blood pressure, cholesterol, high cholesterol, diabetes, smoking all play a huge factor into your health, but also not following up with your medical provider, not having a medical provider, and not knowing that you may be at risk even if you're not having any symptoms. One of the things that is commonly not appreciated a lot is that high blood pressure is known as a silent killer for a reason. So if you understand this, you can, start thinking about, ways to treat your blood pressure a little bit earlier so that we can prevent this from happening, so that we can um, ask appropriate questions, especially talking to your family to make sure that there's no risk factors of heart disease that you need to be aware of. So, um, yeah, that's basically it. So, in addition to, of course, cardiology, I'm also a father, also a son. Got siblings, so it can be very stressful trying to balance everything out. So it's always important to, you know, stay grounded. The benefit of my family is that we do have a lot of people who are in the medical field, sisters and anesthesiologists, cardiac anesthesiologist who's also going for her what is she going for? She's going for her PhD. Also was a bodybuilder at one point, so she's the real goat. My brother is in finance, and my other brother is in computer engineering. Mother is a psychiatrist, so a lot of medical in our family. So, Juliana, welcome. Hope you're doing well. Just kind of leaving it as a free for all for any questions you may have regarding the heart, regarding cardiology, regarding medical school, anything regarding the life of a cardiologist, life of a doctor, because it can be a little bit on the stressful side. So, if you guys, broski, what's going on? Let me know where you guys are tuning in from, and I'll let's go. So, hope you're doing well. I'm doing good. I'm doing good. So, um, one of the best things about my job is that I'm a non-invasive cardiologist. So there's a lot of UK, Canada, what's going up. Um, there's a lot of things that we can do in cardiology that can be very invasive. And when it becomes very invasive, it can be very time consuming. I am a non-invasive cardiologist. So that means that I do a lot of non-invasive procedures, specifically TEEs, to look for potential clots in the heart and shock people out of bad rhythms, but it also means that I have a better lifestyle. So, with the better lifestyle, I have a better schedule other than my colleagues who are interventional cardiologists, but also better schedule. The counterpart, which for me is not a counterpart, my colleagues who will do more interventions have a more stressful lifestyle, but also have a higher income. So there's always the balance in that. Um, how much cardio should I do in a weekly and what intensity? I think the best answer for that is whatever you can do that is most consistent. So I would probably even do low to moderate intensity activities anywhere from 10 to 30 minutes. And I leave that huge range because you want to be able to do it on a consistent basis. One of the best months of my life was I told myself I was only going to work out 15 to 20 minutes, but I did it every single day and I looked amazing. And I looked amazing pretty quickly. It's pretty amazing what your body can do in that short amount of time, but being consistent with your nutrition and with your exercise. So anywhere between 10 and 30 minutes, whatever you can do, 3 to 4 times a week. Um, and I would probably go light to moderate intensity. But whatever you can do that's very consistent. What's your favorite planet? I gotta go with Earth. Fried chicken's final boss. All right. Goofy. I know there's a lot of haters in the chat, but it's okay. Have you accepted Jesus Christ into your heart? Turn up yes. But um, in addition to high blood pressure, I think another thing that commonly gets missed, especially in the world of cardiology, is um, diabetes. And a lot of kind of like high blood pressure, diabetes can sometimes present at a later stage. In one second, just gotta remove some people from here because they're going cray cray. That usually helps a lot too. So for those of you guys who are tuning in, let me know where you guys are tuning in from. But name is Dr. Isang. Um, I use this platform to discuss things regarding heart health and prevention, but just talking about the life of a cardiologist, the life of a non-invasive cardiologist. So I see a lot of different things in the world of cardiology, heart failure, hypertension that is difficult to control, crazy heart rhythms, but also see a lot of things outside too. So that's why outside the hospital. So that's why prevention is always important. The but there's a lot of things that a lot of questions that people can have. And if you have any questions, leave it in the comments. One of the biggest ones that I always get asked is how long does it take to become a cardiologist? So to become a cardiologist, um, it takes 4 years of undergrad, 4 years of medical school, 3 years of internal medicine residency, and then 3 years of cardiology fellowship. There's some people who after pursuing general cardiology will want to do more training, and with that more training it can be an additional 1 to 3 more years. Some people want to do interventional cardiology, heart failure. They may even want to do electrophysiology, the people who put in pacemakers. They may want to do congenital, people who were born with abnormal heart defects from birth. um, I think those are the major ones. Structural to help with heart valve issues. So it's a lot of things that you can do in the world of cardiology. So always important to um, understand that if you're going into the world of cardiology, what type of cardiology do you want to do? Do you want to do general cardiology? Do you want to do more interventions? With that, you kind of have to understand that the more advanced your field is, it may be more stressful. It may lead to more time away from home. So you have to look at all of that together when it comes to being a cardiologist. For those of you who guys are just joining in, leave in the comments where you guys are coming from, any questions that you guys may have. So one of the biggest things that I see in cardiology is issues related to blood pressure. So, one of the biggest questions is what is high blood pressure? What is high blood pressure that we get concerned about? So, the top number greater than 120, bottom number greater than 80 is considered high blood pressure. Start treating it when that top number is greater than 130, bottom number is greater than 90. So, um, when I first see someone who has that blood pressure that elevated, one of the things that I'll do is what can we do naturally to bring that blood pressure down? Can we do things like losing weight and watching what you're eating with the nutrition, um, exercising as much as possible, watching how much salt you're taking in? All those things that you do can bring that blood pressure down significantly. If people are still having high blood pressure despite doing that, then I start looking at medications to help treat that blood pressure, because there are some people who, despite um, lifestyle changes, still will need help with bringing it down with medications. And the reason we want to bring it down is because a combination of high blood pressure, sometimes high blood pressure with diabetes can lead to not just heart disease, but can lead to kidney disease, can lead to people needing to be on dialysis. Other than blood pressure, the most common thing that people are coming to me for is chest pain. So, what is chest pain that gets a cardiologist nervous? So, you have chest pain here. The pain can sometimes move to the left shoulder, but pain that is worse whenever you exert yourself or stress yourself, pain that gets better with rest or medication called nitroglycerin, and pain in this location. If you have all three of those, I'm pretty concerned that your chest pain is cardiac in origin and we need to further investigate that. If you're having that, call your doctor. If you don't have a doctor, go to the emergency department because you could be having signs of a potential heart attack. So if it is, you want to be seen early because if you don't get that treated early, it can sometimes lead to significant complications that cannot be reversed. I've seen people who have quote unquote hole in their hearts. They typically don't survive, but you can have an issue with your heart valve. You can have a potential the squeeze function gets bad and it can't be reversed. So the sooner that you get seen for those symptoms, the better it can be. So if you're having any of those uh, uh, chest discomforts, go get seen by a medical provider as soon as possible. We can run some tests, and if it's significant, if it's scary enough, we will get you seen by a cardiologist, possibly getting a heart catheterization to look for blockage. If if not everything is pristine, then we may get some more testings done. This can be a stress test. It can be an echocardiogram, and if any of those are abnormal, then you would probably go ahead and get a cardiac catheterization. Some people can have all of those symptoms. Um, some people don't have any of those symptoms, and then they will still um, have some discomfort. A lot of times, if all of the life-threatening issues have been resolved, we follow up outpatient to look for both cardiac and non-cardiac issues. So things regarding the gallbladder, the pancreas, reflux, those can all masquerade as chest pain. So we want to do a thorough job to make sure that they don't have any uh, significant life-threatening, life-altering causes of their chest pain if they don't follow up outpatient, and then we continue to figure out what exactly is going on, both cardiac and non-cardiac. For those of you guys coming in, let me know where you guys are coming from. It's Dr. Isang using this to answer any questions regarding heart health, being a doctor, and life outside of medicine. All right, so we've talked about just chest pain, high blood pressure, what we do when people get concerned. Any questions you guys may have, let me know in the comments. So one of the things that people will get diagnosed with is heart failure. So when someone has heart failure, there's kind of two major aspects of it. There's heart failure where the heart is not pumping appropriately. This is known as systolic heart failure. You can also have heart failure where the heart's not relaxing appropriately. This is known as diastolic heart failure. The most common cause of heart failure where the heart's not pumping appropriately is due to coronary disease or blockage in the heart arteries. So whenever someone has that, we want to make sure they don't have any blockage. So we would do a cardiac catheterization to look for blockage. If there's blockage, we open it up with a stent. If there isn't blockage, then we got some more homework to do to figure out what exactly is causing their heart to fail. If someone has heart failure where their heart's not relaxing appropriately, one of the most common reasons for it is high blood pressure. So you definitely want to get that treated appropriately to make sure that that doesn't get worse, because eventually, if it's not relaxing well, it also will start to not pump well too. So, um, and there's a lot of different things that can potentially cause heart failure with issues with the relaxing. You can have things like high blood pressure. You can have a fast heart rate for a long time that can lead to the heart failure. You can have autoimmune conditions that are attacking the heart itself. I've been trying to block them. Every time I block them, they come back. Oh yeah, perfect girl. I appreciate it. I've been trying my best to block some of these people. So there's a lot of different things that can cause heart failure. So a good history is going to be very important. Sometimes even not just getting history from yourself, but getting history from well, not just about yourself, but about your siblings, about your parents, and about your great grandparents. You want to go at least 3 generations because if there's a family genetic history of it, it can help to get appropriate testings done and make sure that, especially that whatever happened to your parents is not going to happen to you or to your children. So getting 3 generations of a history is typically really good too. But also doing the test, whether it's a heart catheterization, looking at your blood pressure, and just getting the simple test to make sure something else isn't explaining why your heart is failing. I think between high blood pressure, heart arrhythmias or fast, slow heart rhythms and heart failure. Those are the 3 biggest things that I see, at least on a daily basis, especially the heart rhythm issues, anything from atrial fibrillation, ventricular tachycardia, POTS, fast heart rates, slow heart rates, people who are pregnant. I see a lot of different things. So there's a lot of things that can cause your heart to behave in an abnormal way. And sometimes ways that we can investigate it, some of the simplest things we can do is, look at electrolytes, look at your magnesium level. I usually want to start people with that to give them magnesium supplementation to see if that helps. Um, Gotta try my best to block many people that are popping in inappropriately. But if you guys have any questions regarding the heart, regarding anything in the medical field, especially cardiac related and being a doctor, let me know in the comments. Give it about 2 more minutes and then I will pop off. Give a little bit of a summary. So what we've been talking about is heart disease, heart failure, high blood pressure, chest pain, palpitations, because there's a lot of different things that can cause palpitations. So that's one that we didn't spend enough time in. So someone has palpitations, what does it mean? I don't exactly know when I first meet them. So I'll do a couple of tests to figure this out. The first one is going to be an EKG because we can check the EKG right here, right now. And if we're lucky and it shows something, then that answers the question. But a lot of times it doesn't. It may give us some insights. So if that's the case, we'll do a heart monitor, and the heart monitor can be for anywhere from 1 to 3 days upwards to um, 70 to 30 days. That'll let us know, especially if you're having symptoms every a few days to a few weeks, we should be able to capture it. There are some people where we can't capture it, and if we cannot capture it, then we will think about possibly putting in a heart monitor. Um, the heart monitor can go for anywhere from 2 to 2+ years, and we can hopefully capture whatever heart rhythm you may have having. One of the patients that we typically do this for are for people who have had strokes and we haven't been able to figure out what's causing their strokes. One of the most abnormal rhythms that can cause this is atrial fibrillation. So if we haven't been able to document AFib, we may put in a loop recorder, a longer heart monitor to see if we can capture this AFib and be able to treat them appropriately. Being that if they do have true atrial fibrillation, they should be on a blood thinner for the rest of your life, because that's going to prevent clots from occurring, and those clots can shoot up and cause strokes. Before I go, just a little bit of an introduction to who I am. I am Dr. Isang, cardiologist, 37 years old. Started medical school at age 2021, so a total of 14 years to become a cardiologist. Worked as a hospitalist for about 2 years, about 1.5 to 2 years. So, 4 years of medical school, 4 years of undergrad before then, 3 years of internal medicine, and 3 years of cardiology fellowship. I practice as a non-invasive cardiologist, and absolutely love the job that I do. It is stressful, but there are a lot of benefits that comes with just being able to change people's lives, being able to talk to them about the importance of heart health and the importance of prevention, understanding what the risk factors for heart disease are. So I use this channel to be able to talk about that aspect, but also encourage people who are considering becoming a doctor or even a cardiologist in the future. I'm going to give it about 2 minutes if anybody has any questions. If not, I'll see you guys again tomorrow. All right, not that many people, not that many questions. I appreciate you guys, and I'll see you guys tomorrow in case you guys have any questions.